talking about uh, Lumi. We were talking about, when I left work today, I rushed out of there. Normally, I blow myself off and try to look a little bit decent, and I pulled hair. And Dr. Canizero, who's with us tonight, you guys know her very well. Is We just ended up talking. I don't know. We were laughing. So, but tonight we're going to be talking about anything you guys want to talk about. I have one topic that somebody sent to me that wants to talk about, which I think is a great topic. I just little housekeeping. When you're leaving your questions on here, make sure that if you're coming from Saving Pets One Pet at a Time, that you write your name if you want me to address your name or know who you are, or you want to introduce yourself to Dr. Canizero, because it doesn't tell me who I'm talking to. I don't know who it is. If you're coming through the spa, for some reason it tells me. And then also, and I apologize, guys, but it's for animals. Anything I do pretty much is for animals. I have to cut this short a little bit tonight because I have to get back down to work. So when we cut it short, it's going to be me. Please, I'm not trying to be rude. I do have to get back to work. So anyway, tonight you guys have met her. If you haven't, you're in for a treat tonight. Dr. Canizero is a homeopathic holistic veterinarian out of Florida. She still does consultations, which I know sometimes we bring people on and they're here to help you while they're here, but they can't help you outside of that because they just can't. Dr. Canizero is still able to do a little bit of that here and there, so you can reach out to her. Lori's going to be typing all that stuff in. But without further ado, Dr. Canizero, thank you so very much for being here again and being so free with your time.
Oh, it's my pleasure. I always enjoy doing these, and I really love being able to give to the community. I know I work and I work hard, but it's wonderful to be able to give back to the community and try to help you guys with your questions, help guide you, help give you some empowered information. So please bring it on with questions. And if you guys don't mind my dogs because my one French bulldog is highly reactive. Any little noise and she's going to be barking. So she'll be joining in or apparently chiming in whether we like it or not. But anyway, so bring it on. And if there's anything you want to, I like your claw hand over there.
Sorry. Okay, that's the other thing I forgot to tell you guys. My laptop isn't working. And so I have to do this on my phone. And in order for me to read this stuff, I'm trying to figure out how I'm going to read these questions to you. So you might have to see my armpit a little bit. I'm sorry. I'm trying to figure this out.
I hope you put your Lumi on.
Right? So I was like, oh, how am I going to read these questions?
I,
Because
I,
normally on my
I think I have my glasses nearby. I can help you out as well. So,
if I miss something, I'm sorry. So, but anyway, okay.
yeah.
So yeah, I have to do it that way for whatever reason. So, but I will say, somebody had written in. Actually, Dee is here right now, and this is such a great topic. We've talked about it, I think, before. Love talking about it because it's one of my something I see a lot. But liver enzymes, and there's this, like, I don't know if you've noticed it, but it's like every dog, if it goes to the vet and they do a checkup, every dog has elevated liver enzymes. And then what I'm seeing, and I don't know about everybody else, but what I'm seeing from my clients is they go in for regular checkups. The test results come back, the vet says, oh my God, the liver enzymes are elevated. And then what happens? Mom and dad, parents, family panic. My dog's dying. And so the vet, even though the dog has no symptoms, nothing. And then the vet starts running a myriad of tests and then comes back and says, well, I don't know. The liver enzymes are elevated. And they throw a bunch of medications at them and some prescription Hills diet food or something. But the liver enzymes never go down. They never go down. And then once a year has gone by and the liver enzymes have never gone down, the vet goes, well, I don't know. And then they stay on that food. So what's going on? That's what I want to know. What is going on, Dr. Canizero? What is that?
Well, I think it's an excellent question, and I want to cover this in a broader sense because there's a number of things that are really going on here. The lab work is intended to give us a guidance, a baseline idea to see if there are any pinpoint things that we ought to be concerned about, and also, kind of baseline to get a baseline to see where the pet's average values typically are. And then, of course, there's the normal or average ranges. So, a couple of thoughts. In my practice, I do see elevated liver enzymes. Mostly, I see elevated alkaline phosphatase, which isn't liver specific. And I think that we have a lot of endocrine disruptors in our food, the crappy foods that are getting fed. Vaccines can cause damage, but I think probably the liver enzymes. Remember, too, that a lot of people are using what I call flea and tick poisons. Um, and your liver is your filtration. I mean, it filtrates your body and tries to take out the bad stuff, the toxic things. That includes, drugs, medications, vaccinations, whatever is in the food. We know there's pharmaceutical drugs in the food. We know there's pesticides in the food. There's genetically modified organisms in the food. So I want to pay attention to the blood work, but the most important thing to pay attention to is look at the animal in relation to the blood work. I don't want to suggest that if I have elevated liver enzymes in my practice that I just blow it off and say, well, I don't care. It doesn't matter. Your pet looks fine now, because in 2 months from now, maybe your pet won't be. Or perhaps your pet will then become later symptomatic. So, but it's okay to do a blood test in a couple of months to see if those values have changed without going berserk. That's assuming your pet is asymptomatic, doesn't have any symptoms of liver disease, vomiting, weight loss, unexplained weight loss, poor appetites, finicky, picky appetites, chronic diarrhea or episodic diarrhea, et cetera. All those could be attributable to liver disease. Excessive water drinking and urination, that could be a liver disease problem. So understand that we need to treat the animal and not the blood work. And what makes me crazy is positive Lyme tests on those stupid SNAP tests that are done in the office. And you go home with a big bag of antibiotics for Lyme disease, and your pet is completely asymptomatic. And you've just been given a bunch of drugs. So don't put your pets on drugs if you have elevated liver enzyme. That would probably be the worst thing you want to do. But I also wouldn't recommend continuing to use flea and tick poisons and improper diets. Feed organic food, whole food, home prepared, pre-made foods with the cleanest ingredients that you can, because it pays dividends. Because if we say, well, my pet's doing, I had a client in today said, oh, my pet's been doing great on Merrick dry food. And yet the dog is pacing around in my office endlessly, never stopped pacing the entire appointment. She was so anxious at Weimaraner. And she was full of lumps and bumps and tumors. Now, I believe they were all benign tumors, but, gray face, highly anxious. And so, you have to ask yourself, what are you going to call healthy? Oh, my dog's really healthy. My dog's doing great on Merrick kibble. I guess when I'm looking at the dog and they didn't, vaccinate as much as many other people do, and they don't use flea and tick poisons, what else could be affecting this dog with the tumors and the lumps and bumps? It could be vaccines from long ago. I haven't done blood work because they didn't want to do blood work on their dog today, and that's fine. I'm not pushy about it. Would have liked to, but that's fine. And she's had a lot of blood work in the past before. But please remember to treat the animal before you. If your pet is acting normal, go see a homeopathic veterinarian if they have elevated liver enzymes. Go speak to somebody like Carrie that knows a lot more about nutrition and better nutrition than, unfortunately, most of my veterinary colleagues. I pride
Thank
myself
you.
on being knowledgeable about nutrition. And if you get a positive Lyme test or a positive test of any kind, and it doesn't match what you're looking at with your pet, ask questions. Don't go home with a bag full of medications. You're not going to do your pet any good by doing that. And most of the Lyme tests, by the way, are antibody tests. It just means they've been exposed. It doesn't mean they're infected.
Right. I had a client, it was so frustrating for me. This was years ago. And she had a dog who was overweight, Maltese. He was overweight. No flea and tick. I mean, this woman clean, right? Like no flea and tick. She doesn't vaccinate. She like nothing. And then he ended up with elevated liver enzymes. And I said, he got to get him to lose weight, number one. The Mayo Clinic, I know for a fact, has done an enormous amount of research on humans for when there's too much fat in the body and the liver enzymes. So we got to get him to lose weight. So we get him to lose weight. He gets down to a healthy weight. Liver enzymes are almost exactly the same. They don't move at all. So, and I can't remember what those numbers were because it's been years. But so we did some diet changes. We went to cooked instead. We tried everything. She tried to eliminate. She was doing a lot of the DoTerra the sense. What is it called? the
The essential oils.
yeah, the essential oils, and she was really into that at the time, and so she was burning a whole bunch of them in the house, and
Oh my
um,
goodness.
yeah, and I said, okay, we have. I mean, they may be great, but they're not great for him. So we gotta pull these things, and so we did nothing. We did, and she would wait like 3 months and then run the test, and 3 months and then run the test, and we just went on and on and on for probably I want to say she was doing this 3 years. And mind you, the dog had no symptoms. So she starts seeing different vets and she's trying different things. She went on a vegetarian diet. I mean, she's tried everything. And now she says, I don't know, that's just what his liver enzymes are. It took three
Homeopathic
years.
medicine, my friend. Homeopathic medicine.
Maybe that's what she needed to do.
Yes.
Actually, she did work with Dr. Michael Dim. And so, and I'm not, this is in no way saying Dr. Dim did anything wrong, but she did do a consultation with Dr. Michael Dim. And that's what my question is maybe raw fed dogs, because he's a raw fed dog, maybe their liver enzymes are different. Maybe that
Yeah, I
test
don't think
result,
so.
because I can't figure, I mean, this dog to this day is totally fine.
Yeah.
3 years. I mean, it had to be at
I'm just
least three
curious, did
years.
they ever do an ultrasound? An abdominal ultrasound? Did she ever do
You
that?
know, the only reason I want to swear that she did is because she did so many things. But
Yeah.
it's
I,
been
I
like,
just would be curious. In a case like that, I might consider an abdominal ultrasound. If it's negative, I
yeah,
don't keep chasing it.
yeah,
But if there are symptoms to treat, and I can't speak to Dr. Dim's treatment or how long she may have worked with him, some
right. She may
people
have
will
only
go
done a phone call with him. I don't know.
if it was only one consult. And some homeopaths, if there are no symptoms to treat, they'll basically say, "Oh, never mind," or and in a
Yeah,
case like that, I might put them on standard process supplements to try to give some additional support, to the liver, to the system. Remembering too that the liver is a filtration. I mean, it is your major detoxification filtration. So
yeah,
there's something that causes insult because these enzymes will only elevate if there is some kind of irritant. And it
yeah,
could be inflammation, chronic inflammation. And also remember that even elevated liver enzymes could be a digestive problem. It may have nothing to do with the liver directly itself because the liver, the spleen, the intestine, the pancreas, all of those are involved in digestion. The stomach, but if you're going to consider the alimentary tract, that's about the same thing. So they're all involved in digestion. The last ditch resort is to consider Chinese herbs because they're not going to hurt anything. But under no
right.
circumstances would I put that particular dog on any drugs or anything like that. Somebody asked about, one person asked, could it be allergy factor? That would have to do with a digestive problem, in my opinion, where the immune system is overactive and maybe overreacting to something. So that's a possibility. Somebody else asked, how long will it take for liver enzymes to normalize? The answer to that can vary. It depends. If you can get rid of uh, the offending agent, then it could take a matter of weeks to months for the liver enzyme to come back down to normal level. And then somebody else asked about a tiny dog that was getting hypoglycemic and was drinking, and that's a chronic disease problem, my friend. I'm sorry to say. So, tiny dogs shouldn't get hypoglycemic collapse or get seriously ill or anemic or anything like that. They shouldn't need glucose given round the clock if they're tiny puppies because they're a tiny breed. That is a chronic disease problem. It needs to
So
be worked out by
I don't
home.
even, I don't know if I'm still on camera because on my phone I'm not. But
You are on
okay.
camera.
So I found these questions. So Coco, we have to. Dr. Canizero is a huge bulldog lover, and so am I. Not that we don't love all the animals, so I don't want to. But I don't know if you read this
French
this
bulldogs.
question.
I'm quite the enthusiast.
Yeah, so I had English bulldogs, and then Dr. Canizero has the little Frenchies. But the 1-year-old bulldog just got over pneumonia. She says where she got that where she got it I have no idea. It was during the horrible air quality in northern Illinois, Canada. The ER vet gave her Baytril. She said that for 4 days the dog was out of, like, behavior wise, was out of control, and she wants to know if you've ever heard of anything like that from Baytril.
Um, I'm going to say yes because drugs can have a specific and non-specific effect. So when we give an antibiotic, you could have kind of an expected effect of vomiting or diarrhea. We know it damages the gastrointestinal tract. But remember that the gastrointestinal tract has the majority of your immune system, but it also has an intimate communication with the rest of the body. So you could definitely have very bizarre behavior. And the cause, I doubt that your dog literally had pneumonia. It was probably a respiratory reaction to the really poor air quality, because bulldogs are not known for their best of breathing. I don't have to tell you that, Coco. And so they would be more sensitive and more in danger with the really bad wildfire smoke and the poor air quality. And therefore, you have to be incredibly careful under those circumstances. So Baytril probably wasn't indicated anyway.
Hmm.
Um, I want to touch on this because I think it's really, really important. Again, it's about treating the blood work and not the patient.
Right.
Um, Veterinarians automatically assume if you have an elevated white blood cell count that you have an infection. They do not equal one another. And I know I've said this on the podcast before. You can have an elevated white blood cell count, and that just means you might just have inflammation. If there's no fever present and the patient has an elevated white blood cell count, you likely, but not definitely, but likely have inflammation. And you can have inflammation and infection, which is inflammation plus bacteria or plus a virus or plus a fungus agent. But I don't know why it would be a surprise to anybody that a 1-year-old bulldog would have a respiratory crisis with really poor air quality. So antibiotics, if you take the totality of the situation, are most likely completely not indicated. But Coco, I want you to be careful because I might say this on a podcast, but I'm not working directly with your dog. I'm not privy to the records and the x-rays and all the information. So I want to give you general information, but common sense is not that common, not even in my profession. So I don't know why we're so quick to dispense antibiotics, not me personally, but vets are so quick to dispense antibiotics and steroids and drugs for everything, without really thinking about what seems to add up best in the breed we're dealing with. It could be your vet is not that familiar with bulldog or brachycephalic breeds. I'm not sure.
The my experience with, well, I don't want to go with all because that's a bad thing to do, but a lot of the bulldogs that I have seen get pneumonia, it's been from aspirating because they eat too fast and they end up, aspirating, and somebody they don't notice that they're doing that. And then the animal ends up getting sick. I've had several bulldogs that have to eat a very specific way, and smaller amounts, and because they eat so fast and they can't breathe, and then they inhale, and somehow they just end up aspirating. So she said she didn't know
Well,
how the
it,
dog
it
got
has
pneumonia.
it has more to do with their brachycephalic conformation. They
Yeah.
tend to have elongated soft palates, and if there's some kind of entrapment or everted saccules, any of those things can disturb the swallowing mechanisms and redirect food in the wrong places. So it's not necessarily from eating fast, because dogs in the wild eat fast. Somebody else is going to steal their carcass. So they're going to eat as fast as they can, and they certainly don't nearly die from it or aspirate because they'd never be able to run away from anything that was coming after them. So that's a bit of a misnomer. Of course, slowing them down from eating isn't a bad idea because of their overall conformation. And then to me, it's controversial whether surgeries for the brachycephalic breed should or shouldn't be done. It's on a case by case basis. If the animal has regular, extremely difficult breathing, then maybe doing palate resections and nares where they cut the nasal openings a little bit bigger, and saccule removals. Maybe those are more indicated.
I'm
Um,
sorry. I'm only laughing because I can hear your bulldog breathing right now.
oh, no, actually, Pebbles and Blossom are playing. So
Oh, I'm
that's
all, what is that
they are
sound?
wildly playing in the background
Those
there.
are really good sound effects for what
Yeah,
we're
they
talking
are.
about.
I know, because we're talking about all the breathing and stuff.
Right, right.
So,
Oh my gosh.
Lisa asked, can dental disease affect the liver? I would say in general, no, but that's a soft no, because again, if you have gastrointestinal disease, which is why you have dental disease, then you could have leaky gut, you could have inflammation of the gut, and any of that can cause liver disease. So it isn't a direct cause. It's a function of the fact that your dental disease in your pet is a digestive ailment. And I can't emphasize that enough. So you can have their teeth cleaned all you like. It is not going to treat the underlying imbalance, which is a digestive disorder, which is never addressed by veterinarians. It makes me so frustrated. Um,
Never.
Jen asks, "Do you recommend a 4 month old probiotics?" I'm not sure if she means the probiotics are 4 months old or should she use them for 4 months.
I wonder if
Probiotics,
she means for her dog that's 4 months old.
oh, it's fine. Understand that probiotics, this is so misunderstood. People have animals that regurgitate, vomit, have diarrhea, and they think, well, I'm just going to put my pet on probiotics. There's a lot of ways of treating the gastrointestinal system, and a good base diet of whole food is definitely one big one. But the other thing is that not all digestive diseases benefit from probiotics. If you don't have the right bacteria in the gut, you can give probiotics all you like, but there isn't good gut bacteria to use it. So you would have to replenish the good bacteria in the gut in order for probiotics to be even effective. And in a 4 month old puppy, if they have been vaccinated several times, they may have significant gut damage. So I can't answer whether that would or wouldn't be helpful. So maybe it would be, maybe not, or you might be wasting money giving probiotics or causing more digestive upset because there is nothing to use the probiotics, if that makes sense. And I
And
like leafy dark greens. It isn't to detox; they're very healthy. They're
so
healthy and they help the body immensely.
So Carol is on here, and she's actually a client of mine. She's been trying to get her dog's liver enzymes down, and it's working. And Carol, I know you told me the name of the herbs that you're using. If you could post that, that would be really great. But she also wanted to know, Dr. Canizera, how long do you think it should, like her liver and his liver enzymes are going down? And she's using the vet gave her, I think it's some kind of a herb. I hadn't heard of it, and it's been 6 weeks and his are going down. How long do you think it should take to go back to what would be considered a normal range?
I don't know how high the enzymes were to begin with. So it's a little bit difficult to say, but I would say probably anywhere from weeks to several months, because it does take time. And if an animal is sick with elevated enzymes of any kind, understand that there will be a lag of improvement in the blood work. The patient will improve first, typically, and then the blood work will begin to improve after. And I think if Carol's pet might be asymptomatic, but in Chinese medicine, we know that that is blocked liver qi and maybe blood stagnation. There could be bilious stagnation, but not to the point that they get jaundice or yellow or whatever. But if we don't have smooth flow in the liver, this is a Chinese medicine conversation, you're going to have elevated liver enzymes because everything's sluggish in the liver and the plumbing is getting backed up, so to speak. And I'm talking about the fluid, energy flow, blood flow, etc., through that organ itself, the chi, which is the energy flow through that organ. When it gets blocked, the liver enzymes will go up. That's why I'm saying it isn't nothing. But it doesn't mean the pet is going to be overtly symptomatic, but it does warrant some kind of intervention in a natural way because we don't want that to become something that is very symptomatic down the road. It's like saying, well, I have all this congestion, but I'm not going to address it. So we want to address that congestion. If homeopathy doesn't address it sufficiently enough, or diet, I might use a Chinese medicine, food, food treatment kind of diet, something like that. I might use something like that.
Yeah,
Jen
it's
asked recommendation for supplementation of the liver. Milk thistle is a really common one. Outside of milk thistle, I recommend canine hepatic support from Standard Process. Other than that, we'd have to dig deeper into your dog's situation.
I think that is what she was taking, but she didn't stay standard process. So hopefully I can't see because
I
I'm
use
on
a
my
lot of
computer.
Standard Process.
I
Lauren
I think
asks,
she did say it was hepatic, but I didn't. She didn't say standard process, so it didn't registered with me.
okay,
But
who has
anyway,
been raw for over 5 years, supplements, etc. Still
leafy dark
came back
greens to
to effective.
detox. There's quite a few questions for you on here. I'm sorry, I'm the worst host or whatever I am tonight,
Well,
because
you're
I'm
trying to
on my
operate
phone.
with your phone. I'm on my laptop, so I could read more here. Jen is asking about recommendations for Boxer. 10 years old, liver enzymes are good, just because she's a senior to keep her liver healthy. What I recommend is good whole food diet with lots of green leafy vegetables. You don't necessarily have to supplement if the pet doesn't really have any clinical symptoms or the lab work looks fine. I mean, I like to use algae and organic algae, organic spirulina. Those are just really nice products, maybe a nice antioxidant for the older pet. Um, as an example, let's see. Sure, okay, I'm looking here. Then the gallbladder acts up, correct? Oh, D is asking. D, I was talking, I think you're referring to what I said earlier. You can have a blocked movement in the liver that doesn't directly back up the gallbladder, because we're not always talking about the bile per se. And that's a 911 emergency when the bile gets backed up, because then you can have very serious liver shutdown. I mean, I'm talking about, actual blockage of the ducts. But I'm talking more energetically, like the energy movement through the liver can cause elevated liver enzymes. And the ultrasound may look perfectly normal. The bile ducts look perfect. And the gallbladder may look fine without any sludge in it. And they may still have elevated liver enzymes. Consider homeopathy or consider Chinese herbal therapy, is what I would say.
So
I don't scroll
here's
down to get more questions. I'm trying to blow through
well,
these.
I'm reading one right now. I'm hoping you can address, just because this is a little dog that she's not that little. I just love her and I see her a lot, and she's struggled for a very long time. She's a pit bull. I think that Lauren, let me know if that's who we're talking about, if we're talking about June. So she's raw fed. She rescued her, and the dog came in just, awful shape.
Is this
Lauren has
Lauren
done
Ray?
Lauren Ray, yeah. She
Okay,
has done
I see it.
like amazing work with this dog to get her as far as she has gotten her. But what her question is, or she's saying, is that, through doing all of the stuff she feels like she's doing right, she got an animal biome test and it came back and it's still showing that there's like no good bacterias in there. What do you think? I mean, she's doing raw probiotics. I don't know if she did the FMT pills, but I
Yeah.
don't know what.
I'm guessing if she did a microbiome test, she may have done that. For the number one thing I would suggest, I like to use a product from Standard Process called prebiotic inulin. That helps to replenish the good bacteria. I think that RX for Pets has another product. I don't use that product. I really like the Standard Process products. You can use other things like psyllium, organic psyllium, to try to help repopulate the good bacteria. But in all fairness, if you've done all these right things, Lauren, I would say to work with a homeopathic veterinarian, because if you're doing all of the nutritional right things and supplement right things, and the gut biome isn't improving, and you did do either fecal transplant or the oral pills, I honestly don't know if the fecal transplant is better than the oral pills. My guess would be it would be.
That
That
was
would be
my question, because I don't think in fact, I'm 99% sure she hasn't done the fecal, like the actual
yeah.
rectal.
Yep.
She may have done the pills, but that was my question. Do you think one is
Understand that
better?
if the patient has an underlying imbalance of chronic disease in the gut, we can throw at the gut everything nutritionally, supplement wise, herbal, whatever. Not antibiotics, of course. We can do those things, but if the patient continues to have an imbalance, they're not able to sustain that improvement with a fecal transplant or anything else. And so, in my opinion, if we don't restore balance through the use of a proper homeopathic medicine that's been worked up by a homeopathic veterinarian, you may not get that, real seeding of improvement of all the good stuff that you're putting in.
It's
And I don't know
interesting.
if she has tried, and again, this is an external try thing too, so it may not be enough. You may not be able to get it done without homeopathic treatment also. In some patients, I will ask them to improve diet first before I actually treat homeopathically. Sometimes I jump right in and give a homeopathic remedy. But in this case, Lauren's done a lot and she hasn't made that much progress. I would ask, though, what are the boxers? And it's not a boxer. That was somebody else. Sorry. What is the dog's symptoms, the pit bull symptoms? Are there still symptoms? Are there any symptoms? Or are we just looking at a lab test? Because we have to be careful about treating the lab and not the dog.
Yeah, it's still the skin, and I think she's had a couple flare ups. She could, if she's, I can't read the questions. It takes me forever to try to scroll through here and find them. But I just happen to know June, and I know she was saying she was flaring up, and but she
Yeah,
was
then she has
pouring.
symptoms, so I would work with a homeopath. I really would, because I think she's doing everything she otherwise could do, and it's not clearing the symptoms up because it could take a little while for the biome test to actually look better and better. I've been working with a puppy. I have some really great clients, and I have a client that wanted to pretty much do everything with a golden retriever puppy. And the puppy had diarrhea when she got him. And then I recommended doing a fecal biome test. It did come back abnormal. Then we treated, continued homeopathy, treated with some supplements. Prebiotic inulin was one of them. And we repeated the test, and the biome improved. It's not 100%, but her puppy is now 6 months, 8 months old. I can't remember now. But anyway, her puppy is completely asymptomatic. Skin's perfect. Bowels are perfect. So it's fine. We'll be patient and watch, because the clinical symptoms are better. The test is better. It's not 100%, but it's better. So let's give the body time. But it sounds like she is still struggling with overt symptoms.
Yeah,
So,
yeah.
and the fresh fecal transplantation may be just another thing you're throwing at your dog that just can't stick. No pun intended.
All right, listen, guys. That was rapid fire answers for you. Boom, boom, boom. Usually we have a little bit more time to kind of go around a little bit. So, but you answered so many of them. That was awesome, and you guys brought so many great, great. Even for me, like I really learned so much from the questions that people ask. And I'm glad we talked about liver enzymes, because I can tell you that that is, aside from the seizures that I'm seeing, like all the seizures that I'm seeing from all the animals that are, aside from that, I think the elevated liver enzymes is something that my clients are mostly complaining about is, oh, she was just in
I'm
last
seeing
week.
a lot of I'm seeing a
Yeah.
lot of seizures in my practice. I'm going to answer another quick question. Somebody early in the program here asked, "Can stress bring on gastrointestinal issues?" Any stressor of any kind can trigger a weakness of imbalance in the individual. So, absolutely, anxiety can trigger gut problems, and it's a question around that. I may not have answered that precisely how it was asked, but that's what I could remember of the question because I don't see it up here. Um,
Well, I can tell you that yes, for sure.
well, yeah,
Anytime I
you
get,
do boarding too, so you
oh
definitely
yeah,
need
I can tell
to
you
find that
without a
question.
doubt, anxiety and gut are related. And I think they're related the opposite way that people think they're related. Like I think people think, oh, my dog got nervous and now he has a gut problem. And I think your dog has a gut problem and that's why he's getting nervous. So,
Well, they
um,
actually they're very very interrelated.
yeah,
Think of it this way, well, of course I'm dating myself, but kids that took Ritalin because they were hyperactive, what made them worse? Sugar. So
yeah,
I'm not saying that there's all sugar in food, but think of it the same way. If we're feeding foods that ostensibly don't benefit the gut and might contribute to a lack of nutrition or even an increase in sugar, you can absolutely expect that that's going to play on anxieties and probably
right.
play on the Weimaraner that I saw
Sure,
today.
sure.
If you don't improve the diet, homeopathy is going to help, but it may not be able to take them over the finish line, so to speak.
So really quick, because I think you guys will get a lot out of this. I worked with a client one time for, we were dealing with skin and ear issues. So we ran an animal biome test just for the heck of running it. And when we got it back, this weird bacteria came up that not that I'm not a microbiologist, so it's not like I know all the bacteria. But when this one came up, it came up in red. And so I was like, oh no, like what's happening? So I called Dr. Gantz, who is the founder of that, and I said, what is this? And she said, oh, that's an interesting bacteria. It's non-native to the canine's gut. It's found in humans that have ulcers and anxiety. They're linking it to those things. And I said, well, that's interesting because this dog's on Prozac. This dog was so nervous that she couldn't even go out to the mailbox without this dog having the worst anxiety ever. So anyway, we changed the diet. The problem with this study, which I can't really call it a study since it was only one dog, but it was interesting observation by me. But I blew it because I changed his diet at the same time we started doing the fecal transplants. But I had to help the dog. So we changed the diet, we do the fecal transplants, and then we keep testing the dog later to see if the anxiety was going down along with that red bacteria, which I'm sorry, I can't remember the name of it, but you could probably call Animal Biome and they would tell you based on the information I gave you. And sure enough, she got that dog off of Prozac, and when we tested it, we watched it go down. We watched this bacteria go down and the anxiety go down, and then eventually she said, "I'm going to wean him off the Prozac." Now, we also changed the diet, so I can't it's a variable that we have to put in there because she was feeding a high carbohydrate sugar kibble. But it was interesting to watch that bacteria go down and his anxiety go down. So her name was Mia.
Yeah.
So anyway, I just thought I'd share that with you guys.
I haven't seen the anxiety level drop the way I'd like to see it because I've been
Yeah.
watching that a little bit. There's not enough animals that I have followed in that way.
Yeah.
A case like that should definitely have homeopathy. And,
Yeah.
the thing is, I don't know how well received I was today with the Weimaraner because they came wanting to talk about flea control. And
Oh
the
yeah.
elephant in the room was the fact that the dog never once could stop pacing and running back and forth in my office and banging
Yeah.
at the door and running back and forth, not even clinging to her person, but that was the elephant in the room. And
Yeah.
how
They're not going to listen.
to help that? So he's like,
Yeah.
well, what's the homeopathic medicine for? And I said, well, how anxious she is,
Yeah.
and hopefully this will help with fleas too, which I hate to say that I added that in there for, like I didn't want to ignore what they came in for.
We
But
have to plant those seeds. So
we do
all
the
right,
best we
guys.
can. All right.
You're amazing. I'm so sorry I'm cutting this short. I have to be back to work by 6 o'clock. So I gotta get my shoes back on and get my cat
Bless your
off
heart.
me. So I will see you guys next time. Dr. Canizero, thank you, thank you, thank you so much.
You are
For you
so
guys that are
welcome.
listening, Dr. Canizero's out of Florida. Again, you reach out to her. There are very few homeopathic veterinarians. I'm bringing you one of the best ones in the country. So take advantage. She has time. You're lucky. She may not tomorrow. So, veterinarian stuff can be like that, right? Like one day you're like, you've got 9 million patients, and then the next day you're like, oh, where'd everybody go? But
Well,
I
now
suspect,
lately I've been booking about 2 months out. And
yeah, well,
yes, you can come down and work for a few days. Absolutely, please. Don't
I
let that
swear.
deter you. Make an appointment with myself or another good veterinary homeopath. You can go to theavh.org and be prepared to either travel or be prepared to do a telephone appointment if that homeopathic veterinarian does a telephone appointment. But I
Yeah.
encourage you to find a homeopathic veterinarian. In my experience, and I'm also trained in traditional Chinese medicine, you can see I have Chinese medicines behind me as well. You can't see my homeopathic medicines. Those are in a big cabinet that's over that way a little bit more. I want you, in my experience, homeopathic medicine reaches the most deeply to cure the majority of cases from skin problems, allergies, GI issues to cancer, knowing that I can't guarantee treatment outcomes for everybody that I treat. I wish I could, but we all want to.
Nobody can. The conventional vets can't.
No,
That's
they
the
can't.
thing.
None of us
That's what
can.
always bothers
Although,
me about that is people will go to their conventional vet and treat the same problem for the entire life of the dog. It never
yep,
gets resolved. Then they go to a homeopath. It doesn't get resolved the very first time they go, and they say, "Oh,
right.
she's a quack."
Yep. I know. So be out there and be supportive because that happens to us all the time.
Yeah,
Where people have been years and years with unsuccessful treatment and have less tolerance for the homeopathic vet.
yeah. That makes
And I
no
know
sense.
they're at wits' end at that point, but we are actually starting from scratch, my friends. So,
Right.
and we're having to undo the veterinarian
Undo the damage because there's so much more
that has
damage
exactly right.
that's been
So
piled on it. So
be patient. I think for me, homeopathic medicine is the most rewarding, and I still use some of my traditional Chinese medicine and acupuncture, but not nearly as much as homeopathic medicine. And
yeah,
feel free to reach out to me or somebody you feel comfortable with on theavh.org and get involved with a homeopathic vet because we are the most holistic veterinarians out there. The other ones are folistic, excuse me, that are offering vaccines and flea and tick poisons and dental cleanings on a regular basis. And that's not a holistic veterinarian. It's an allopathic veterinarian who offers some holistic medicine modalities, that their focus is allopathic medicine. That
Right.
is their go-to. That's what they're going to go to first, etc. And the Thriving Pet Expo. Ooh, that sounds exciting.
Yeah.
Yeah.
It's my hat. I just think every single pet parent in the world should be coming to this event. I know that I'm Lori and I are putting it together, but that's not why I think you should go. I think you should go because of the speakers that are going to be there and all of the stuff that's going on. And Dr. Canizero is going to get her butt on a plane and come out. You need to.
I'd
So,
love
but
to. I would love to. Well, not I
yeah,
wouldn't
well,
love to get on a plane, but I'd love to come
I know,
out and
I know.
and the answer is yes. If I don't know your page, Paw Formative, but yeah, no, I'm happy to speak to you guys. I don't know how to do that, so you
Awesome.
have to reach out.
She'll set it
So
up with you. So,
absolutely.
all right, guys, I gotta go. So sorry.
So you
We'll
need to
talk.
go. All
Yeah,
right.
we'll talk.
Thank you so
Thank you,
much.
guys.
Thank you, everyone. Appreciate
Bye,
it.
everybody.